Okay, thanks so much, Alex. Well, the adventurous 20-year-old told her parents that she was going for a drive in Provo Canyon, but she never made it home.
Preliminary findings are helping to shed some light on what happened to Hadley Boberg. The 20-year-old Provo woman's body was found by a sheriff's deputy up Provo Canyon. That deputy also found a man who was with Boberg, also suffering from hypothermia and frostbite. Right now, deputies believe the two were camping in the area at Provo Canyon when Boberg died. The Utah County Sheriff's Office is not looking at this death as a homicide at this point.
Hadley's death was a combination of alcohol and weather-related issues, hypothermia issues.
Well, Dr. Sandy Fryhofer is with me now. And Dr. Sandy, officials say that Hadley died from exposure to the bitter cold, but also to the effects of alcohol.
Right. You know, Reynolds, a lot of people think that alcohol will help keep you warm, but it does the opposite. It actually lowers your body temperature. For example, when you're cold, your body's first defense is to constrict the blood vessels in your skin.
Sure.
That's where you lose most of your heat. Next is shivering. Shivering makes heat, also keeps you warm. Alcohol interferes with both. It actually dilates the blood vessels in your skin. That's why you get those warm, rosy cheeks. It also makes your body sluggish, so you can't shiver as well. Both of these can make you more prone to hypothermia. Also, alcohol impairs your judgment, and you may not realize that you're cold.
Is there anyone that is more susceptible than others? I mean, who exactly is at most risk in this?
Well, we certainly don't think about 20-year-olds. Usually it's in the very young, the very old, people with medical conditions like heart problems, arthritis, diabetes, Parkinson's, people on certain medications like sedatives, also people with mental disabilities, even Alzheimer's patients, for example. They might not know to put warm clothing on before they wander outside, and certainly people that are using drugs and alcohol, as in this case.
Okay. Let's back up for a moment. Let's say we're going out, we're going to go for a hike. It happens to be in a very cold setting. What are signs we need to look for hypothermia?
Shivering is the first sign.
Okay.
Also, you might get a little more clumsy, lack of coordination, slurred speech. You get a little tired. Your breathing becomes shallow, more rapid. Your heart rate increases. And then your organs start to fail as you get colder. And some people die, as in this case. The CDC says, on average, about 600 people die every year from hypothermia. And alcohol, in this instance, had a big part.
And so preventable. All this is so preventable.
It certainly is. These are needless deaths. And, you know, if you're going to be outside in the cold, think ahead, have some warm blankets. If you run into someone who's cold and you're trying to resuscitate them, you know, warm blankets, warm, non-alcoholic beverages, put heat packs, try to warm the core first, so put them in the neck, the chest, the groin, and be gentle with their body. Don't use a heating pad. That's just way too much heat, way too quickly, and it actually can cause cardiac problems. So stay safe, and remember, alcohol may make you feel warm. It gives you those warm, rosy cheeks, but increases your risk of getting hypothermia and can kill you.
Dr. Sandy Fryhofer making the complex very understandable. Thanks so much for your time this morning.
Reynolds.
Excellent stuff on a very, very touchy subject, no doubt. All right, folks, we have more coming up.